If you're having back pain during pregnancy, your doctor, your provider might just kind of blow it off and say, well, that's common in pregnancy. But it may be common, but it's not normal. And so if you're having low back pain in pregnancy, I invite you to stay tuned to learn exactly what's going on and what you need to do about it. Hi everyone, my name is Lynn Schulte and I'm a women's health physical therapist and a birth recovery expert at Intuitive Hands Physical Therapy in Boulder and Denver, Colorado. And today we're going to be talking about low back pain in pregnancy. While this is very common, it's not normal to have low back pain during pregnancy. Actually, your provider might blow it off and say, oh, well, you're pregnant, what do you expect? But actually, pain is a sign of dysfunction, that there's something wrong in your body that's not able to handle that increased load of a pregnancy. And there's one particular area of your back that, if is in dysfunction, might hinder your birth. And that's your sacroiliac joint. So here's a picture of the pelvis here, and this is your sacrum right in the middle here, and these are your two iliac bones. If I turn it around here, you'll see this is the sacrum and these are your two iliac bones. Right where these two meet is called the sacroiliac joint. The reason this is so important during pregnancy is that this joint needs to move the most for pregnancy. So when the baby's coming into the pelvis, the sacrum needs to rotate back here, and then when the baby's coming out of the pelvis, the sacrum needs to come back to open up. So this motion in the pelvis here is super important for birth. So if you're having pain in that sacroiliac joint where those two little bumps are in your back, so it's right on the sides in your low back, and sometimes you have a little dimple right where this joint is. And if that's where your pain is, that's a sign of dysfunction going on, and this joint might not be able to open up like it needs to for birth. So if you're having pain in the sacroiliac joint, and you'll know that it's in the sacroiliac joint, that if you stand and try to lift one leg up, or you're getting dressed and you put one pant on or one leg in a pant leg, that creates that pain in that low back. It's a stabbing, shooting pain. That means that sacroiliac joint is not in its happy place, as I like to call it. And there's a dysfunction going on there, so you need to go get some help. A Webster chiropractor might be able to help you, or a women's health physical therapist, as they specialize in this pelvic region. And it's super important for you to get this checked out to make sure that your pelvis can open up and allow that baby to come through. There's several things that can be causing some sacroiliac joint problems. One is the uterus, that's big with baby in the front here, has two uterosacral ligaments that attach back here onto the sacrum. And if those are tight or restricted in any way, you might notice that the baby's off to one side in your belly. That can cause an imbalance and kind of pull on that sacrum in the back here and cause pain in the sacroiliac joint. You can also have abdominal restrictions in the front, and also you can have tightness in your pelvic floor muscles. This sacrum needs to move and bend. As we bend forward, the sacrum moves, and as we straighten, the sacrum comes back and forth like this. And so if the muscles are tight back here, where they attach from the sacrum to the front here, if they're too tight, it doesn't allow that movement to happen, and that can cause low back pain. Tightness in your pelvic floor muscles is not good for birth, because those are the muscles that need to open up and expand to allow that baby to come on down. So getting your pelvic floor muscles checked out if you're having sacroiliac joint dysfunction is also very helpful as well. So good luck with this. Definitely, if you're having low back pain, go see a practitioner, a chiropractor, women's health physical therapist. Someone who specializes in pregnancy-related pain will be super helpful for making sure that your pelvis and your pelvic floor are able to do what they need to for birth. All right, good luck everyone. Take care. Bye-bye.